Good evening and welcome to the Facts About COVID Vaccines community webinar. I am Imam Monawar Hussain, Muslim Chaplain at the Oxford University Hospitals NHS Foundation Trust. Thank you for joining us and for the excellent questions that you've also kindly emailed. We will do our very best to pose as many of those questions to our panelists as possible. Before I pass you on to my colleague, Reverend Sarah Sewell, who is the lead chaplain for the Oxford University Hospitals NHS Foundation Trust, I want to say a few words about the format for this evening's webinar. Our aim is to have 3 presentations and then open up for question and answers. This should mean about 25 to 30 minutes of presentations and the remaining 30 minutes addressing some of the questions you have already emailed us. This webinar is being recorded. Please feel free to comment via the chat, and this recording will also be uploaded so that those who could not join us this evening can also have access to it. If you've sent a question and it's not addressed in this session, I plan to send you an email with resources in the hope that will contain further information. I will now pass you on to my colleague, Reverend Sarah Sewell, who will introduce our panel.
This evening, and I need to apologise for my voice. Hopefully it'll keep going, but Imam Monawar will take over from me if my voice gets bad. So I'd like to introduce our panellists, first of all, starting with somebody that I know well, or at least I know, and that's Sam Foster, who's the Chief Nursing Officer for Oxford University Hospitals NHS Foundation Trust. That's always a bit of a mouthful, but it's good to say. Sam is an experienced chief nurse who worked at the Heart of England NHS Foundation Trust for 8 years, where she held the role of chief nurse for 4 years. Sam has also worked in a number of other trusts, including Shrewsbury and Telford and Frimley Park. Sam has a strong focus on nursing and midwifery education, having worked in both trust and university education roles in her earlier career. Dr. Rais Lunat is currently completing the prestigious National Medical Directors Clinical Fellowship, where he is a clinical fellow to Professor Stephen Paris, the NHS National Medical Director. He's currently working in the NHS COVID-19 Vaccine Delivery Unit with a specific focus on BAME NHS workforce. Outside of medicine, he founded a social enterprise which has held over 100 events educating minority and ethnic communities on preventative medicine. Dr. Kieran Collison has worked in Oxfordshire for many years and is a GP in Witney. Prior to this, she trained in Cambridge and London, worked as a hospital medical physician for several years before becoming a GP. Kieran played a central role in setting up the 5 GP urgent access hubs around the country in order to improve patient access to urgent appointments. Kieran has also been the CCG lead for diagnostics and maternity services. Priorities include increasing diagnostic tests in the community, as well as supporting the development of an improved perinatal mental health service. Dr. Kamal Taha is an accomplished scientist in his field of research, which is tumour immunology and vaccine development in hematological malignancies. He has published extensively in his area of research and contributed to many scientific conferences nationally and internationally. He is an active member in various scientific groups in the UK, Singapore and Malaysia. He's currently working as a consultant for the Oxford Prospects programme, teaching the immunology module and contributing to course administration and curriculum development in immunology. He's also a visiting academic at the Nuffield Department of Medicine, University of Oxford. Dr. Mohammed Akhtar is a cardiologist and member of the British Islamic Medical Association COVID response group. Dr. Omar Latif was born and bred in Oxford and graduated from the University of Nottingham. He works as a local GP at the Ancient Medical Group and also regularly works in the out-of-hours service, including at Mansell Way. He is the clinical lead for long-term conditions at Oxfordshire Clinical Commissioning Group, which includes the care of patients with diabetes and asthma or chronic obstructive pulmonary disease. What a distinguished panel we have here this evening, and I'm glad I managed to get through all the medical terminology that I've been practicing today. So thank you.
Thank you very much, Sarah. And thank you also actually for being part of this, knowing that you've had this voice issue for a few weeks now. But thank you for being part of this. So may I now invite Sam Foster, please, who is the Chief Nursing Officer of Oxford University Hospitals NHS Foundation Trust. So Sam is going to speak about the impact of COVID-19 on colleagues, but also the vaccination program. And Sam also gave me my first COVID vaccine injection or vaccination. So thank you so much for being with us, Sam.
Pleasure. It's lovely to be here this evening. Lovely to be with my colleagues. So thank you very much for asking me. So I'm only going to talk for a couple of minutes, really, just to talk through how things are in the NHS at the moment for us, and a little bit about the vaccine programme before handing over to my other clinical colleagues. So people will know, because they've seen much on the media, the impact that COVID has had and continues to have across health and social care, both personally and professionally, and we continue to find this a huge challenge. From a patient perspective in the hospital, we continue to have double the number of patients in our care now than that of the peak of the first wave. At OUH across Oxfordshire, many of us have had to adapt and provide what we call surge capacity. So my colleagues on the panel will be looking after many, many more patients than we normally would do this time of year. We've really missed visitors and the partnerships that we have with family and loved ones in our hospitals. From a staff perspective, our teams are pretty exhausted. Many of us haven't had time off since way before Christmas, and we're very much focused now on recovering together as our admission numbers start to settle. It really does look like the lockdown and the vaccination programme is starting to have an impact. But the large number of patients that we have with us and that my colleagues are caring for out in the community are going to be with us and needing our care for a number of weeks to come. So we need to really start to work through their recovery plans, our people recovery plans, and the recovery plans across our services for people whose treatment's been postponed. I'd also just like to thank all of my colleagues on the call and all of our colleagues across health and social care that continue to work as one huge team in Oxfordshire. We are a real one team. Many times we've come together to work through pressures, and many times we've received huge support from the community, and I'm sure there are people who are dialed in this evening that have supported us. So the government have set up a number of ways for us to deliver the COVID vaccine, initially starting with the hospital hubs, and we were one of those first 51 operating out of the Churchill site, initially with the Pfizer vaccination, and latterly settling up some hospital hubs on the Horton Hospital site and at the John Radcliffe with the AstraZeneca. And that's where I gave Monawar his first vaccine at the Ocdem. I also had a great opportunity when I thought I was just going to have my photograph taken, giving the first Oxford vaccine to one of our patients, and then faced the world's media, completely unbeknown to me, and set up, I think, by my communications team. Had I known the night before, I might not have turned up for work, but it's been an absolute privilege to be part of setting up the hospital hubs and working with my colleagues across primary care so that we can learn from each other and share all of the best practice so that we can really maximise the opportunity to roll out the vaccine. So people will know that our population has been placed into 9 groups, with care home residents and care home workers being the priority groups, with the over 80s, social care workers, and members of the population who fall into the clinically extremely vulnerable people in the first groups. Our staff vaccination programme has been really successful. We've really enjoyed promoting the vaccine and protecting our colleagues from across the Oxfordshire health and social care system, many of whom have now been vaccinated. Every single person has got their own personal story when we vaccinate them. Many of my colleagues have been shielding for over a year, and their whole being has been taken away from them. And it really has been quite emotional meeting colleagues and seeing the impact that it's had on them, giving them the vaccine. So I just had a quick look online earlier on. Week ending the 28th of January, over 6.2 million vaccines have been given. And all of our colleagues have been vaccinating today, I know. So that number is just rising and rising across the country. There's a huge commitment to continue with the programme and taking part in sessions such as these. We're really looking forward to discussing people's comments and questions that they'd care to raise. And Monawar, you must remind me at the end, we want to make a plug for the Vaccination Registry. So we'll do that and we'll communicate with colleagues at the end of the call.
Thank you.
Thank you very much, Sam. And now may I invite Dr. Ace Lunat, the NHS Medical Director's Clinical Fellow, for his few minutes of presentation.
Thank you for that, Reverend, and thank you for that kind introduction earlier. And thank you for everyone for taking the time out of your evening to tune into this webinar. I genuinely hope you find it useful. So like mentioned, my name's Rais. I'm a junior doctor by background and currently have the privilege to be working in the COVID-19 vaccine delivery unit, particularly looking at how we engage with minority ethnic communities with the COVID vaccination programme. I'm by no means a world leader or expert in this topic area, and certainly we're privileged to be joined by other panel members who have far more knowledge, experience and expertise on a lot of what will be discussed today. However, I do understand that genuine concern exists around taking the COVID-19 vaccine. And I totally understand. As a member of the public, information regarding vaccination is being thrown at you left, right and centre from all directions, whether that's television, radio, family, friends, individuals in this country and abroad, and social media. WhatsApp, Twitter, Facebook, it's everywhere you go. A King's College London survey run late in 2020 suggested that 34% of the UK population had been exposed to messaging which discouraging them from vaccination. And I can understand as a member of the public, it's genuinely difficult to separate what's truthful, what's factful, and genuinely what isn't. So just talking about a bit around that topic, some people have suggested that the COVID-19 vaccine causes irreversible and severe side effects. All of the trial data to date suggests that the truth around this is that the COVID-19 vaccine actually causes temporary and reversible side effects. And these often include things like a bruised arm, a painful arm, or a flu-like illness. And the flu-like illness is more a sign that the vaccine is working and it's starting to take a toll. When I had my COVID vaccine, what must have been maybe 3 or 4 weeks ago now, all I had was a painful arm for 2 days, a bit of paracetamol, and then it was fine. And since then, nothing else. Some people suggest that the COVID vaccine contains ingredients such as pork, gelatin, or alcohol. This is not true. They do not contain these ingredients. And most of the scholarly bodies across the world have declared the vaccine as halal, kosher-friendly, and vegan. Certain individuals suggest that vaccines are being used to track and chip the population, to tell the government or other organizations your whereabouts every minute and every second. Again, the science and the experts suggest that this is not true. None of the evidence suggests that there's a 5G implanted chip or tracking device in each vaccine vial. And if we're being truthful and very honest about it, there's far easier ways for individuals to track people these days rather than a vaccine. Something we often hear much about is people think the vaccine was delivered far too quickly for it to be safe. But we're living in a very unprecedented time. The global nature of this pandemic has allowed this to occur. Most diseases which we need vaccines for often affect a small number of patients across perhaps certain countries. And usually it takes a significant amount of time to get the right amount of funding and the right patient cohort to even initiate trials to develop a vaccine. COVID-19 is a global disease with global priority. As a result, we have so many patients that could currently go into trials straight away. Governments across the world throwing millions, billions in fact, to develop a vaccine extremely quickly. The science and sharing of knowledge on a scale we've never seen before. China sharing the genetic information of the vaccine early on to allow the science companies and the scientists to start working on it as soon as they could. The important part is the vaccine has gone through the same safety checks that all other vaccines in the UK would have done by the Medicine and Healthcare Products Regulatory Agency, or what you might see as the MHRA. Certain individuals or certain arguments have stated that we should just wait for herd immunity. Why should I take a vaccine? The key with herd immunity is that it works if the majority of the population have had COVID. At present, estimates in the UK suggest we've had around 3 or 3.5 million cases, somewhere around amongst those. And unfortunately, we've already had over 100,000 deaths. If you think about the population of the UK, it's almost unimaginable the amount of deaths that we'll need to be in a situation of herd immunity. Other individuals have suggested that there's no point taking the vaccine as it won't work against the new strains. At present, the science and data suggest the vaccine is effective against these strains. However, it's important to acknowledge we're in a dynamic situation and this is a continuous process and the science is continuously evolving. So although a vaccine is being issued, as the situation is constantly changing, scientists are also constantly keeping a track of the new strains and vaccine effectiveness. Some people have suggested since they're young, fit and healthy, they don't need a vaccine. However, since the new wave of the pandemic began, it's estimated that 40% of hospital admissions are between the age group of 18 to 64. Yes, the risk of complications and death is higher as age and comorbidities increase. However, COVID can cause severe complications and unfortunately death in younger age groups. The vaccine is designed to reduce the risk of these across all age groups. My final message is, verify before you amplify. You trust doctors with your lives when you have a heart attack, need surgery, or are unwell. Please trust us when it comes to COVID vaccine. In the same way that we know the virus transmits rapidly between individuals, so does information. So when passing information on to your networks, try and ensure it's scientifically accurate and from trusted sources, and ensure we're all part of making an informed decision process regarding vaccination.
Great, thank you very much, Rose, for that. May I now invite Dr. Kieran Collison, Chair of the Oxfordshire Clinical Commissioning Group, who will speak about the safety within the COVID vaccination setting. So people have not been out very much and they want to know whether it's safe for them to come out and have their vaccine. So over to you, Kieran.
Thank you very much and good evening, everyone. I hope everyone's well and safe. And thank you for taking time out of your busy day to come and join us this evening. I wanted to, talk about the actual vaccination process. So if you have got to a point where you feel like you do feel confident enough to have the vaccine, but you perhaps are a little bit concerned about going to a vaccination site, I just wanted to run you through what it might look like if you haven't been to one already. I know just from my own family members, particularly my older family members, I know that particularly one of them has had a letter dropped through their door inviting them for a vaccine. And whilst he actually really does want the vaccine, he actually has admitted that because he hasn't really been out for many months or really not much at all, he's actually really quite anxious about going out and seeing lots of people and going into an environment where suddenly he thinks it potentially could be quite busy, and that really worries him. And I think that's probably quite a common fear for people. So I just wanted to try and put your mind at rest really from that perspective. So just to give you a bit of a flavour of what it will be like. So in terms of actually getting an invitation, some people may have got them already, and if you haven't, when it's your turn to be invited, you might be phoned by a practice, you might get a letter, you might get a text message. There are various ways you might be invited, and that might be to come to your local practice or to one of the practices in your local area. It might be to a pharmacy. It might be to one of the big vaccination centres. There's one open up locally here in the football stadium. So there are lots of different ways that you might be able to be invited in. Whichever one you choose is absolutely fine. You pick the one that you want, and that's absolutely fine. Choose the one that you're most comfortable with. When you go, some people are a bit worried that if they've got certain medical conditions or on medications, that might mean that either they won't be able to have it, or if they do have it, they might end up with more of a reaction than someone else. What will happen is when you arrive, that all your medical problems will be gone through by somebody, and they'll have access to your medical records. So if there are any concerns about anything, any medications that you're on or anything like that, they will take the time to go through it with you. And if you have any questions, that is the time to ask. So no one will give you the vaccine until you feel completely happy to have it. When you're there, be also reassured that social distancing is absolutely happening. It's very important. You'll be given a specific time to arrive. And I would advise, try not to be early and also try not to be late, because it's very clearly timed so that there is plenty of time for social distancing and time for people to come in and leave as well. You'll probably find it's a bit chilly. All the windows are open for plenty of ventilation, but that's a good thing. And everything is also cleaned down. It's very hygienic and everything is cleaned as it should be so that there is no transmission of virus, and that's really important. So all the measures are taken to make sure it's as safe as it can possibly be. Once you've gone through and happy that you feel fit and well to have the vaccine, it literally is a matter of about a second, or it's popped in your arm. I had mine in December, didn't feel a thing. It was in, it was out, and I was out of there. So some people will be asked to wait around just for a few minutes after, just to make sure that there's no reaction. On the whole, there really isn't. I think I've seen one person who felt a bit dizzy. Other than that, out of the hundreds of people who've come through, everyone's been absolutely fine. And as has been mentioned in terms of side effects, generally people have handled it very well. A bit of a sore arm for a day or two, maybe a bit of a flu-like illness, but other than that, it's actually very well tolerated. So I hope that helps to sort of give you a bit of a sense of what it's like. But if you are worried, people are there to answer your questions, and they will give it to you when you feel absolutely ready to go. So thank you.
Thank you very much, Kieran. Those presentations have been really very helpful. We've had quite a lot of questions come into us before this, this webinar, which Monawar has tried to put together so that we're not asking lots of the same questions. So if you did put a question in, you may not hear your exact question, but you should hear one that's related to the question that you asked. If you're asking questions on the chat, that's what Monawar was talking about, that hopefully we can get something out to you in an email about some of the things that aren't raised, and some of the panelists might see them and include them in their answers. What I'm suggesting, Monawar and I are going to alternately ask the questions, and any of the panel that feels they can answer them, if you could just raise your hand, and either Monawar or I will say, please respond, Rais, or whoever it is, and then hopefully we'll get somewhere. So I have the first question to ask, and this is, and it's sort of something that's already been talked about. I've heard that scientists have been working on COVID vaccines for years with no success. How come they've managed to produce a vaccine that is allegedly effective and safe in just a few months now? Maybe Rais, that's, oh, sorry, Dr. Kamal, you'd like to say something, yeah. You'll need to unmute yourself.
Good evening, everyone. Pleasure to be with you. And looking at the number of people who joined us, it's definitely it will be a successful webinar. To answer the question, we have heard so much in the media about this in the platforms, social platforms, and there is a lack of, obviously, lots of people don't know what was happening on the vaccine field. There was a vaccine against the SARS virus in 2003, and it was developed by the Chinese, by a number of Chinese scientists. And obviously it wasn't mediatized because the SARS virus, after a number of months, disappeared completely from the scene after a rate of infection of about 8,000 people. The Chinese managed to contain it, and it didn't reach the level of dramatic level we are witnessing now with the COVID. So saying that there was no vaccine against coronavirus is not true. The reason why the COVID vaccine has taken much less time than the usual time a given vaccine takes, is not only the tremendous efforts done by many groups working on the field, the financial support many governments have given to these groups, but also the fact that things were done in parallel, the different phases that a given group works on vaccine. Obviously, you need to take into account the in vitro work, and then the animal studies, and then the phase 1 trials. And between every phase, there is a number of months to wait to get clearance to move to the next phase. Whereas in the context of COVID, because of the emergency, all these phases were almost run in parallel. But we need to make sure, we need to mention this. Running in parallel these phases doesn't mean jeopardizing the safety issues. So all the trials, all the clinical trials were done according to the highest standard of safety. So these things need to be known, and I'm sure the public, I'm sure lots of people know about this, but in the media, maybe this doesn't come across as clear as it should be.
Thank you very much. Dr. Luna, did you have anything to add, or is that everything that you would want to say about it?
No, I think Dr. Taha answered that quite well.
Okay, thank you. I'll hand over to Monawar for this.
Great. Well, thank you. And thank you also, Sam, for the responses you're putting in on the chat. That's really important. That's very active. Lots of questions coming in. And as Sarah mentioned earlier, I think this is our first webinar. You know, all the questions, some of them are not going to be answered because we just don't have the time, but we're going to make note of them, send them back to you in responses in our resources in terms of information that we send back to you. And hopefully you will find an answer for those questions. One of the questions that's kind of come from a number of different people, it's been around the efficacy of the COVID vaccines in the light of the change in the time between the first and the second vaccination. So first is, will this lower the level of protection? The second, related to the same question about efficacy, is that, is there any scientific evidence for the decision to go against Pfizer's guidance, i.e. of 3 weeks? The third was, if I have had a first dose of Pfizer vaccine and there was an issue with supply, what happens then? Do I then have to take another vaccine and do 2 of those vaccines? So that's roughly, you know, relating to the time gaps. So whoever really of the panel who want to try and answer that. Any? Yes, Amr.
Thanks, Monawar. Thank you, everyone, and for inviting me, and for those of you who are taking out your evening to come and listen to us. So very pertinent questions. I think it's important to recognize that in the studies that were done, it's not easy to compare the different studies between them. So I know a lot of people are talking about one being 95% effective and the other one being, you know, 79 or 89% effective. It's not that easy just because the endpoints in the trials were a little bit different. The question is fair though, which is in the Pfizer trials, most of the people who had the vaccine at either between 3 to 6 weeks, actually. So 21 to 42 days was what the trial participants had. And so the question, of course, is fair. Well, if you're giving it at 12 weeks now, is that fair? The Oxford vaccine actually did have an arm of the trial where some patients were given a vaccine at 12 weeks. And they found that actually it was fairly effective at 12 weeks as well. What the JCVI and the chief medical officers have done is they've done a sub-analysis looking at patients who had the Pfizer vaccine. So if you look at the people who had the Pfizer vaccine, it takes about 2 weeks for your antibody levels to rise to a level where you might get protection. And so the fair assumption that has been made is that if you got COVID within 2 weeks of having your jab, well, the difficulty is you probably were going to get it anyway. It's not because of a failure of the vaccine. It's just because actually it's only 2 weeks since your jab. And so you haven't had a chance for the vaccine to work. And so actually, if you looked at the population then who got COVID after 2 weeks, and similarly, then you look at people who had COVID from then up until 2 weeks after the second jab, and you look at that proportion, actually the rates of effectiveness was still fairly high. The other thing that's important to mention is the government and certainly the chief medical officers have quite a difficult decision to make. There's the options are really to have some people who have very high effectiveness from the vaccine, but actually we know, as I say, that waiting for 12 weeks will still give most people significant cover and significant protection. And I think the important thing is that the most important thing that vaccine does is it prevents you having a serious illness. It may not prevent you getting COVID altogether, but it'll prevent you getting a serious illness and certainly prevent you hopefully ending up in hospital or passing away with it, which is what the trials evidenced. So I think there is fair to say that there is good logic behind why some of these decisions have been made. And the idea is that actually by giving lots of people one vaccine rather than half the number of people 2 vaccines, actually we can get wider coverage amongst the population and bring down the overall level of effectiveness across the community. So I think that's some of the reasons, and I would just encourage people that even if you hopefully having heard that are aware that actually yes, that we're expecting the vaccine at 12 weeks will be effective. We've just heard in the last few days actually from NHS England that we are expecting by the end of next week, actually they're hoping to tell us when our second deliveries will come in. So as GP practices, we're getting information all the time about when our second deliveries might come in, and we're hoping within the next couple of weeks we would hopefully know when that is. So yes, we're fairly confident that we will have a supply chain, which means that you will get your vaccine at 12 weeks. Thank you.
Great, thank you, Amr. Anyone else want to add anything to that? I've just seen a chat from Rosilia from the Eastern Maries community. Just to let you know, Rosilia, that we're actually recording a message in Tatum, I hope I pronounced that right, but in the local East Timorese language, a local doctor is recording that, and we'll be circulating that through the trust as well.
Thanks, Monawar. We go on to another question. Question is coming. Do we know why people from ethnic minority groups are 4 times, they say, more likely to die from COVID-19? Is there a reason, and can anybody answer that? Dr. Akhtar.
Hi, thank you everyone for joining us this evening. So I think there's been much made about the prevalence of myths within particularly ethnic minorities that may be responsible for kind of the lack of vaccine uptake in the ethnic minority community. And this is particularly important because, as we know, the ethnic minority community, the Black, Asian and ethnic minority community are at a much higher risk of COVID mortality. The reasons for this are manifold. So a recent study that reviewed the electronic health records of about 1.4 million individuals above the age of 55 years old reveal quite a few shocking kind of conclusions. One was that, for example, a 40-year-old Asian male would have the same health impact as a 60-year-old Caucasian male. And some of the reasons that they identified was that individuals from a Black, Asian and ethnic minority are more likely to have underlying health conditions such as diabetes, hypertension, but also individuals from an ethnic minority or Black and Asian background are more likely to experience worse treatment when engaging their primary healthcare services. They're more likely to report insufficient support from their local services such as housing and social care. And all of these inequalities generally reflect a lack of funding, engagement, and insight from government policies in this arena. What I think it's really important to appreciate is that COVID-19 is a health crisis within a bigger health crisis, which has a much longer health crisis, a much more long-standing issue of health inequality and health inequity that has really not been paid as much attention to as I guess it could have. And so the first step in this process is ensuring that those at the highest risk of COVID-19 mortality and statistics such as individuals who are from a Black background have a 4 times higher mortality. We know from, as a cardiology registrar, for members of my colleagues in the workforce, 95% of the doctors who unfortunately passed away from COVID-19 were from a Black, Asian, and ethnic minority background. 64% of the of nurses were from a Black, ethnic, Black, Asian, and ethnic minority background who passed away from COVID-19. So we are at a much higher risk. We definitely do need to take advantage of the treatments that are available, and in this case, these are the vaccines. We have to do whatever we can as the medical community to try and ensure that whatever barriers are in place between ethnic minorities, Black and Asian individuals engaging these treatments are removed where possible. But we have to be aware that this may not be an overnight fix. There are a lot of long-standing issues, many of which are genuine from the Black, Asian, and ethnic minority community, whether it's an experience of a bad healthcare experience or failures from the medical community in terms of engaging ethnic minorities that will take time to fix, but it's important for us to acknowledge them now. Otherwise, Black, Asian, ethnic minority individuals may just say, well, why are you paying attention to us now, all of a sudden?
Thank you very much, Dr. Akhtar. Back to Monawar for the next question.
Yes, thank you. A question that's come up on a number of occasions is, does the vaccine cause infertility? And who'd like to take that one up?
I'm happy to answer that one.
Yes.
If that's all right. No, it doesn't cause infertility. It is something that we do hear a lot, but it doesn't cause infertility. And when you look back at all the other vaccines that are being used, not for COVID, but for all other infectious illnesses, none of them have been linked with infertility. And this one is no different. So I think it's an excellent question, and I'm glad it's been asked because I hear it being asked a lot. And so I think it's really important to clarify that it doesn't affect fertility. I think it's important to say that people who are pregnant already, because in the trials, pregnant women didn't have the vaccine during, they didn't have it as part of the trial. So there is a little bit of, it's not thought that it causes any harm, but it's only because there isn't any evidence because pregnant women weren't in the trials. So if someone is pregnant and they're thinking of having the vaccine, many people who are pregnant are having the vaccine, but it is worth a discussion with your clinician first, just to be sure you can be fully informed. But when it comes to fertility itself, no, it doesn't have an effect on that.
Thank you.
Sort of linked two questions. One is, can one carry and transmit COVID-19 to other people if you've already been vaccinated? And I think linked to that is, if you've had COVID-19, should you be vaccinated? So it's that dual thing. Anybody willing to answer that? Dr. Latif.
I see Dr. Tahir had his hand up as the immunologist. He may be better qualified to answer, so I'm happy to defer to Dr. Tahir.
No, that's fine. Go ahead, and then if there is a comment, I will join up with you.
Excellent. Okay. So at the moment, we don't know whether it does confer. So when it gives you immunity, what we don't know is actually, can you still be a carrier and pass it on? So actually this evening, or this afternoon, I was doing a clinic in Witney vaccinating patients. And so certainly the advice we've been giving is that we still don't know whether you could actually, the vaccine could prevent you catching the illness, but that you may still be carrying it and passing it on to someone else. We just haven't had enough research into that. So certainly the evidence at the moment, or the advice at the moment, is that you should still continue socially distancing, wearing a mask, even once you've had your second jab. Of course, the important thing is to say that you don't have full protection until a few weeks after that second jab anyway, which will be at 12 weeks, but that you could still carry it and pass it on to someone else. So it's important that you do, everyone still carries on socially distancing and wearing a mask. Monawar, what was the second part of that question? My apologies.
It was if you've had COVID-19.
Oh yes, good point.
You'll be vaccinated.
Yeah, so that yes, at the moment, again, the evidence is that yes, you should. There was quite a large trial looking at healthcare professionals last year who caught COVID, and they looked at essentially how long you had immunity for. It's difficult to know because it depends on the extent of the illness that you had and your antibody levels. They think it's probably in the region that you may have protection up to 5 months, but it's difficult to be absolutely certain. But interestingly, when they did, they followed these healthcare professionals during the trial, and they also looked at did they have high levels of virus in their own nasal passages and so forth. So they're doing regular swabs, and they found that actually, yes, they could be immune themselves, but that actually some of them did have quite high levels of virus within. So yes, at the moment, we don't know how long the vaccines, if we're being completely honest, confer immunity for. There's a consideration that it may be similar to the flu jab in the fullness of time, that actually this may be an annual vaccine that we all need to have. But at the moment, certainly, because most of the trials we're looking at about 6 months, so that sort of data will come through in time. So yes, if you've had COVID already, you should still get vaccinated when you're called. Dr. Tahir, I don't know if you wanted to add anything further to that.
I think you have summarized the main points, really. What is important to know also, that studies are at the moment being carried out in Oxford and in other places to clarify these issues. Obviously, COVID is fairly new. We have been with COVID for a year, and most of the research was zoomed into the vaccine work. But in parallel, some of the groups were actively looking at issues like that. And I'm sure in the next few months, light will be shed on these issues.
Thank you. Over to Monawar.
Yeah, no, thank you very much. We have a question here, someone who's had COVID and they've heard that it has once you've had COVID, you have about 5 months immunity. Should they get vaccinated?
I'll just follow up on my earlier answer, if that's okay, Monawar. Yes, you should still get vaccinated. If you've had a positive COVID swab, I should just clarify, in the last 4 weeks, the government, or certainly the guidance, is that it's still safe to have the vaccine, even if you've had a recent positive result. There is some suggestion that you may want to wait for a number of weeks, up to 4 weeks. And the reason for that is that if you became unwell, it'd be difficult to differentiate, was your illness due to the illness just getting worse, or did you actually have a reaction to the vaccine? That's not an absolute contraindication to having the vaccine, though, but it may be that if you very recently had COVID, in discussion with your clinician, they may suggest waiting for a little bit longer. But yes, if you've had COVID, you should still go ahead. And just to answer the question that's come in the chat, is about whether it'd be better to have one vaccine for your first shot and a second vaccine for your second shot. No, you should, I think as Sam answered in one of the earlier questions, you should stick to the same type of vaccine that you've had for both doses, really.
Okay. One of the questions that we've had is, if you have a background of allergies and using EpiPens and having asthma and things like that, should you go for one vaccine rather than another? And will you get that choice, or will it be down to whatever's happening in your area, and how will that be decided? Because obviously some people are nervous that some things might trigger their allergies. So who could look at that? Dr. Latif again, great.
So it happened. So I had the same scenario. I had the same scenario earlier this afternoon when I was doing my vaccine clinic. So I happened to know. So there was some suggestion when the Pfizer vaccine first came on. Really, they rolled it out in the hospitals, as Sam mentioned earlier. And the reason is that's a safe way to monitor if there's any reactions. There were a couple of episodes where there was some anaphylactic reactions to Pfizer. And so at one stage, the guidance was to avoid the Pfizer vaccine if you'd had any anaphylactic reaction. As was suggested earlier, we've now done a few million of these vaccinations, not just here in the UK, but worldwide. And now there's good evidence to suggest that actually, unless you've had a specific anaphylactic reaction to a component of that vaccine, whether it's the Pfizer one or the AstraZeneca one, then it's perfectly safe to have the vaccine. There's a few caveats just to put in there, though. That one is if you've had multiple, and this isn't just allergic reactions, but this is anaphylactic reactions where really you've ended up in hospital, needed adrenaline, needed significant medical attention. That if you've had lots of different anaphylactics, so some people have nuts, wasp stings, another medication, there's a suggestion that it may be better to wait for the AstraZeneca vaccine. And so at the moment, we as GPs and as people giving the vaccine, it's not always possible to say which vaccine will be available on the day you go. But when you get there, the clinician will talk that through and just mention that you've had different allergic reactions. And if it's the Pfizer one, they probably will recommend, if you've had multiple anaphylactic reactions, to wait for the Oxford AstraZeneca vaccine. The other scenario is where the anaphylaxis is to an unknown item. So for example, I had a patient earlier today who had a vaccine in the past. She can't remember which vaccine, but she had an anaphylactic reaction. And so if you don't know what you had an anaphylactic reaction to, again, the guidance is that it's better to wait for the Oxford AstraZeneca. But if you know what you've had an anaphylactic reaction to, and it's not a component of either vaccine, then either vaccine is perfectly safe for you.
Great. Thank you very much, Amar. There's a question from Maggie Lewis here. We have lots of daily statistics in terms of infection and death rates. And she wants to know, are there any, do we have any percentages or in terms of numbers of people with long-term COVID symptoms? Anyone?
Yeah, so just to clarify the question, that was ongoing symptoms? I missed the beginning of the question.
Long-term COVID symptoms. So do we know how many people, who contract COVID end up having long-term COVID symptoms?
Yeah, so this is something which is increasingly becoming known about, and people are calling it long COVID. And in terms of how many people are getting it, we're still learning, I think it's probably fair to say. But if you look at the different studies that are starting to emerge, it looks like between 5 and 12 weeks after having the infection, it looks like roughly 1 in 5 will continue to have some sort of symptom. And then most will recover by the 12-week mark. But there are still some from 12 weeks who will continue to have symptoms. And it's thought that might be around 1 in 10 people might continue to have some sort of symptom. Now, that's not to say that it's necessarily a very severe symptom. It might be quite mild. It might be some ongoing tiredness or some aches and pains for some, which will gradually get better with time. But there might be some where it is more severe and they will need some help. And that's when seeking attention, some medical attention for that is advised. But on the whole, most people do recover fully within a few weeks.
Great, thank you.
Thank you very much. Next question, I'm just looking at a question on here, which is very long, so I'm trying to work out how to not have it so long so that I can get the question out. It's about the anti-vaxxers, that the person that's asked the question says that the government seems to have dismissed or anti-vaxxers as the lunatic fringe, but there are actually quite a lot of people who are just really worried about the vaccine, and they're not necessarily on that lunatic fringe. And it may be that different family members feel differently, and how difficult that is if you're in a family where some people agree with it and some people don't. Just wondering whether the CTG can put out some information, particularly to those who've been shielding. I think Dr. Kieran was saying earlier about how frightened they could be, but some more information to people so that they can make those decisions more quickly, especially for clinically vulnerable people who are caught up in the anti-vaccine theories and how that works. It's a difficult one, that, but if anybody, Dr. Akhtar is, sorry.
It might be better for someone, I guess, from the Oxford CCG to maybe chime in as well about this. But in terms of the misinformation that's prevalent around COVID-19 vaccines, we're all well aware that, particularly on social media, there's essentially a lot of untruths about COVID-19 vaccine. We at BIMA, the British Islamic Medical Association, have a vaccine information hub on our website, britishema.org, where maybe some of your members have seen some of our Mythbuster slides, which are essentially a series of infographics where we deal with common questions and concerns about the COVID-19 vaccine, whether it's concerns about the vaccine needing to be 100% effective, whether it's infertility, as we've already discussed, and other untruths about COVID-19 changing your DNA, which is not true. Essentially, a lot of the concerns that are, or questions or misinformation that's put out onto particularly social media is available in that Mythbuster slide set. And as far as I'm aware, it's been translated into Urdu and I think one other language, I can't remember which one now, but it's in the process of being translated into many other languages. So I think if anyone wants to, aside from using established resources as well that are also available from NHS England, and there's also BME London that's put out a nice poster about some of the misinformation about COVID-19. But if I would advise any of your members to consult our slide deck, and I'm sure their question or concern is there, and they can equip themselves the next time they encounter someone from the quote-unquote anti-vax community. I would like to emphasize, though, that I think one of the techniques in addressing this so-called anti-vax community, it's important for us, just as in medicine, to not lump individuals together. And I think that's what the questioner was highlighting. A lot of people aren't. The anti-vax community is a combination of individuals who are conspiracy theorists, individuals with genuine, sincere concerns about vaccines, individuals who are political opponents of the COVID-19 vaccine, which somehow has become politicized. So it's a very heterogeneous group. And if we are to be effective in dealing with these individuals, we have to kind of separate out each group and try to address their concerns head on. So that's what I would mention. I would like to just add on to, I think, the long COVID question as well. There was a recent study of around 50,000 individuals and their electronic health records looking at long COVID. And surprisingly, the rates of multi-organ dysfunction, particularly among individuals of ethnic minority, are quite high. If I remember correctly, it was about 770 per 10,000. Individuals experience higher rates of cardiovascular, respiratory, and diabetic complications as a result of having COVID-19. And I think this is a point that we really need to emphasize, particularly to individuals who are maybe younger and may say, although we're seeing plenty of individuals who are 30, 25, 35 without any past medical history ending up on the ventilator in the intensive care unit after contracting COVID-19. It's very important to emphasize that COVID-19 is not a condition where, even if I do get a mild illness, I'm kind of there's scot-free. There's no long-term consequence. As a cardiologist, I'm seeing individuals with heart failure as a result of COVID-19. There are individuals who have chronic kidney disease as a result of COVID-19. So as one of the other my colleagues mentioned on this panel, it's a new disease. We're still learning a lot more about it, and definitely the safe thing to do would be to be cautious, and in this case, achieve herd immunity via vaccination, as opposed to essentially contracting the COVID-19 virus, and who knows what might happen even if you do survive.
Thank you very much, Dr. Akhtar. I'm handing back to Monawar now, but we are coming very close to the end of the session, so I will bow to Monawar as to how many more questions we're going to take, but I'll hand to him.
Thank you, Sarah. I just want to, Kieran, did you want to come back on the point about clinical commissioning group, or do you want to?
I think my colleague actually said everything very eloquently, but if there are specific things that the CCG can help with, then I'm absolutely all ears, would want to hear what we can do to support.
No, thank you. We've got lots of comments as well, and as I say, we'll copy and paste them. I'm sure we will be able to provide resources for people. There is one question here from Moira, who has 2 daughters in Dubai. It is offering the Sinopharm vaccine, but there do not appear to be phase 3 trial results published. Is it safe to take it? Is that a hand up for you, Dr. Akhtar? Or do I just need to lower your hand?
I think you just need to lower my hand. Thank you.
Is anyone?
Dr. Taha, he wanted to say
Dr.
something.
Kamal?
Yes. The vaccine that was developed by the Chinese is what we call an attenuated viral vaccine. Basically, they take the virus. The procedure has been with us for more than 50 years. It was the standard method of vaccination up to the last maybe 10 years. Where the virus is taken, it's passaged through different temperatures, and that leads to the virus losing its ability to infect or to cause infection. But it will conserve the ability to cause or to generate an immune response. So it is a procedure that is known to be safe, but obviously the phase 3 trials are coming. I think they will be published soon. From what I read recently, I don't think there is any problem. The Chinese have vaccinated up to now more than 7 or 8 million people. So, and there is no evidence of major side effects. So that's the answer I can give.
Thank you. We've got a couple of minutes, and I know we need to do a shout out to the vaccine registry. Sam, would you like to do that?
I'd be delighted to. So there's an NHS COVID-19 vaccine research registry, which there is no obligation to sign up to a study if you're contacted. I'm hoping that Monawar will send out the link to all participants. But it really is a call to action, really, to volunteer, to support research. It's for adults who can register their details online. We've got more than 6,000 people across Oxfordshire signed up. And it's just really important that clinical trials into a number of vaccines continue. Different vaccines are working in different ways, and we still really, really need to collect important information about which vaccines work best, which are best for different groups of people, etc., etc. So I think if we can share the details with participants, Monawar, and as I say, no obligation to be on any trials or doing anything in particular, but really information gathering to support research would be fantastic.
No, of course. I mean, one of the outcomes from our session this evening will be an email I'll send out in the next few days, and that will have various different links, and in consultation with colleagues at the Oxfordshire Clinical Commissioning Group as well. So We're almost 9 o'clock. I'm glad that we've kind of kept to our 1 hour session. I sense with the comments and the question that we've had, we've not been able to cover everyone's questions, and I apologize for that, but there just wasn't enough time. But I would say that we're going to make every effort to provide resources and more information that you will be able to hopefully consult and then find some answers to your questions. So I want to say a very warm and wholehearted thank you to all our panelists for giving up their Saturday evening. And it's incredible what you can achieve in 1 week, because as I said earlier, I only spoke about this to Dr. Kamal. We had a conversation last Saturday, and today we've had a huge benefit for many people and for us. But thank you to the panelists. Thank you also for the audience who've joined us. I hope it's been helpful for you. I hope you found it fruitful, and just take care and look after yourselves, and together with all the efforts, we will get through this. So thank you very much and take care. Bye-bye.